Good afternoon, everyone. My name is Wendy Santos. Thank you for being here. Today, I'll be presenting a public health nursing intervention designed to address human trafficking at St. Joseph's Medical Center in Stockton, California. This issue disproportionately affects vulnerable and underserved populations in our community, and nursing plays a vital role in identifying and supporting victims. Let's begin by understanding the public health issue and the population impacted. Human trafficking is a form of modern-day slavery in which individuals are exploited through force, fraud, or coercion, most commonly for labor or commercial sex. This grave violation of human rights affects people across all demographics, but certain populations are especially vulnerable. At-risk groups include immigrants, runaway and homeless youth, people experiencing poverty, and individuals with substance use or mental health disorders. These groups are often targeted due to their limited access to protective resources and support systems. For example, immigrants, particularly those who are undocumented or have limited English proficiency, may fear deportation or law enforcement involvement, which traffickers use as leverage to control them. Runaway and homeless youth frequently lack adult supervision and stable living conditions, making them susceptible to exploitation by traffickers who offer deceptive promises of shelter, affection, or financial support. Individuals struggling with substance use or untreated mental health conditions are also at heightened risk, often manipulated through addiction, threats, or emotional dependence. Barriers such as language, lack of transportation, and fear of authorities further restrict access to healthcare and social services. Many victims are isolated and economically dependent on their traffickers, which decreases the likelihood of seeking help. Furthermore, the psychological trauma associated with trafficking often leads to distrust in professionals, including healthcare providers, complicating efforts to identify and assist them. These challenges highlight the critical need for coordinated trauma-informed and culturally competent care across healthcare and community systems to effectively support trafficking survivors. Several interrelated factors contribute to the high prevalence of human trafficking in Stockton, California. The city's geographic location and significant socioeconomic disparities create a landscape that traffickers exploit with ease. Stockton sits along major transportation corridors, including Interstate 5 and Highway 99, which are known trafficking routes that facilitate the movement of victims across city, county, and even state lines. This accessibility makes Stockton a strategic hub for traffickers who seek to operate in areas with both transient population and limited surveillance. Socioeconomic challenges such as poverty, unemployment, lack of affordable housing, and high rates of homelessness make many residents especially vulnerable. Individuals experiencing housing insecurity, particularly youth and undocumented immigrants, are more likely to be manipulated through false promises of stability, employment, or relationships. Traffickers often prey on those with few financial or social supports, using coercion, manipulation, and dependency to maintain control. These conditions are exacerbated by systemic inequalities, including limited access to education, healthcare, and legal protections. Healthcare settings, especially emergency departments, are key touchpoints for trafficking victims, but too often opportunities for identification and intervention are missed. A lack of standardized training for healthcare staff on how to recognize and respond to signs of trafficking leads to underreporting and delayed support. Victims may present with injuries, untreated chronic conditions, or signs of trauma. But without proper screening tools and staff awareness, these indicators may go unnoticed. Compounding this issue is the absence of safe and confidential environments where patients feel secure enough to disclose their circumstances. Victims may fear retaliation, deportation, or judgment, especially if healthcare professionals are perceived as authority figures or lack cultural sensitivity. The proposed intervention, a nurse-led trauma-informed screening and referral program, addresses significant gaps in identifying and supporting victims of human trafficking within healthcare settings. Nurses are uniquely positioned to detect subtle signs of distress, such as inconsistencies in patient stories, physical signs of abuse, or controlling behavior by a companion. These frontline professionals often have more time and opportunity to build rapport with patients, making them key to early identification. The intervention includes structured training for nurses and other frontline staff on recognizing red flags of trafficking, conducting trauma-informed interviews, and maintaining cultural sensitivity. Training also covers how trauma impacts victim behavior, which is essential for building trust and promoting disclosure. Validated screening tools can be embedded into intake and triage workflows to normalize and process and protect patient privacy. When a potential trafficking victim is identified, the nurse initiates referrals to local community resources, including legal aid, behavioral health, housing, and advocacy services. Establishing strong community partnership and secure referral protocols ensures continuity of care and long-term support for survivors. The intervention also includes the creation of confidential HIPAA-compliant reporting systems that prioritize patient safety and autonomy. Integrating this approach into standard workflows promotes a consistent, compassionate response and empowers victims to safely disclose their experiences and begin to the path to recovery. This intervention has the potential to significantly improve both the identification of human trafficking victims and the quality of support they receive. Early recognition is critical. It can prevent continued abuse, exploitation, and trauma. Victims often interact with healthcare providers while still under the control of traffickers, making the healthcare setting one of the few opportunities for identification and intervention. When healthcare professionals, particularly nurses, are trained to recognize subtle indicators of trafficking and apply trauma-informed approaches, they can intervene sooner, potentially altering the trajectory of a survivor's life. A key component of effective intervention is trust building. Survivors of trafficking often experienced repeated betrayal, manipulation, and violence, which can make them worry about authority figures and hesitant to disclose their experiences. Nurses are uniquely positioned to form therapeutic relationships due to their frequent and direct patient contact. Using active listening, empathy, non-judgmental communication, and culturally competent care, nurses can create a safe space where patients feel seen, respected, and empowered to speak up. Beyond identification, meaningful support includes connecting survivors with comprehensive wraparound services and address their complex needs. Legal aid is often required to navigate immigration status, expunge criminal records, or seek protection orders. Safe housing is essential to escape exploitation and reduce the risk of re-victimization. Access to behavioral health services helps survivors cope with the psychological toll of trauma, including PTSD, anxiety, and depression. Additional support, such as job training, education, and childcare, further promotes stability and independence. Integrating these services into the care pathway ensures that survivors are not just treated for immediate medical concerns, but are supported in rebuilding their lives. A multidisciplinary approach combining medical, social, legal, and mental health intervention results in more holistic and sustainable outcomes. It reinforces the idea that healthcare institutions are not just treatment centers, but gateway to safety, empowerment, and long-term recovery. When implemented effectively, this intervention not only enhances patient outcomes, but also strengthens the healthcare system's role in combating human trafficking. Two major ethical concerns when caring for victims of human trafficking include respecting patient autonomy and preventing re-traumatization. Victims may not be ready to disclose their experiences or accept assistance, and nurses must carefully balance the need for intervention with sensitivity for the patient's readiness. Using trauma-informed care principles, nurses can avoid pressuring patients, which helps prevent further psychological harm or feelings of loss of control. Maintaining strict confidentiality and obtaining informed consent are critical, especially since mandatory reporting laws may require disclosure without the patient's full agreement. Clear, honest communication and cultural sensitivity are essential to minimize harm and build trust, ensuring patients feel safe and respected throughout the care process. By prioritizing these ethical considerations, healthcare providers can foster a supportive environment that empowers survivors while safeguarding their rights. In California, mandatory reporting laws under Penal Code 11166.5 require healthcare providers to report any suspected abuse or neglect involving minors to appropriate authorities. This legal obligation is designed to protect vulnerable children and youth from ongoing harm by ensuring timely intervention. For adult patients, however, the reporting requirements differ. Unless there is a direct and imminent threat to the patient's life or safety, healthcare providers generally are not mandated to report suspected human trafficking cases involving adults without the patient's consent. This distinction underscores the critical importance of obtaining informed consent when working with adult survivors to respect their autonomy and decision-making capacity. HIPAA regulations further safeguard patient confidentiality by restricting unauthorized disclosure to protected health information. While these protections are fundamental, they sometimes intersect with mandatory reporting laws, requiring nurses and healthcare providers to carefully navigate privacy while fulfilling their legal duties. Understanding the nuisance of HIPAA and state-specific laws allows nurses to maintain trust with patients, ensuring they feel safe disclosing sensitive information without fear of unnecessary exposure of breach of privacy. In addition to state laws, federal legislation such as the Trafficking Victims Protection Act or TVPA plays a vital role in supporting the rights of trafficking survivors. It not only criminalizes trafficking activities but also provides survivors with access to essential services including legal assistance, medical care, housing, and protection from deportation for certain immigrant victims. Nurses must be familiar with these federal protections to advocate effectively for patients, connect them to appropriate resources, and help navigate complex legal and social service systems. Overall, comprehensive knowledge of both state and federal laws enables nurses to tailor their approach according to each patient's situation. This legal awareness ensures ethical care delivery, protects patient rights, and promotes a trauma-informed patient-centered response to human trafficking. At St. Joseph's Medical Center, the emergency response to human trafficking is carefully designed to be both comprehensive and trauma-informed, addressing the unique challenges faced by underserved populations. Recognizing that victims often come from marginalized groups with limited access to resources, the hospital emphasizes culturally sensitive care and ensures that screening and interventions occur in private, secure environments that prioritize patient safety and confidentiality. Healthcare providers receive specialized training to identify subtle signs of trafficking, such as physical injuries, behavioral cues, or inconsistencies in patient stories, and to use validated screening tools effectively without causing additional trauma. An interdisciplinary response team at St. Joseph's includes social workers, nurses, physicians, and representatives from community organizations, and they work collaboratively to provide a coordinated and compassionate approach to care. This team facilitates rapid assessment, connection to essential services, and ongoing support tailored to each survivor's needs. Confidential reporting protocols enable both patients and staff to raise concerns safely, fostering an environment where victims feel supported rather than threatened by disclosure. Partnerships with external agencies, particularly the San Joaquin County Human Trafficking Task Force, strengthens the hospital's capacity to respond effectively by providing legal assistance, victim advocacy, and shelter resources. Interpreter services and on-call advocates are readily available to overcome language barriers and ensure that survivors understand their rights and options. Emergency department staff, often the first point of contact for trafficking victims, are equipped with the training and resources necessary to identify and respond appropriately. Recognizing the critical importance of this initial encounter is the survivor's path towards safety and recovery. This holistic, survivor-centered model at St. Joseph's Medical Center exemplifies best practices in trauma-informed care and multi-sector collaboration to combat human trafficking in the community. Collaboration among multiple sectors is essential to effectively address the complex issue of human trafficking. Hospital administration plays a critical role in endorsing policy changes that prioritize victim identification and trauma-informed care, as well as by facilitating ongoing staff training to increase awareness and competence among healthcare providers. Law enforcement agencies such as the Trafficking Human Trafficking Task Force are responsible for investigating, tracking cases, apprehending predators, and ensuring victims' safety through legal means. Meanwhile, shelters and nonprofit organizations provide vital services including safe housing, counseling, and comprehensive trauma recovery programs tailored to survivors' unique needs. Nurses occupy a pivotal role with this collaborative network by acting as connectors between healthcare, law enforcement, and social services. Their close patient contact and understanding of medical and psychosocial needs position them to coordinate care, advocate for survivors, and facilitate timely referrals to appropriate community resources. To optimize these interactions, establishing formal agreements such as partnership protocols or an interagency collaboration framework between organizations is crucial. These agreements clarify roles and responsibilities, improve communication, and create streamlined referral pathways that enhance efficiency and reliability. Such coordinated efforts ensure a seamless continuity of care and enabling survivors to access comprehensive support without unnecessary delays or fragmentation. By strengthening collaboration across healthcare, legal, and social service sectors, communities can build a robust safety net that not only addresses immediate needs but also fosters long-term recovery and reintegration for survivors of human trafficking. Implementing this intervention requires adequate funding to support essential components such as staff training, development of resource materials, and the creation of secure infrastructure for safe screening and referral processes. One valuable funding source is the Slave to Nothing Foundation, which offers grants specifically dedicated to anti-trafficking initiatives and survivor support programs. In addition, state-level funding opportunities like those from the California Office of Emergency Service provide financial support for projects addressing public safety and victim services. Healthcare-focused grants that prioritize underserved populations can also be pursued to supplement resources, particularly those aimed to improving access to care and addressing social detriments of health by strategically applying for multiple smaller grants from diverse funding bodies. The intervention can build a sustainable financial foundation, ensuring ongoing training, program development, and community collaboration to effectively combat human trafficking over the long term. To summarize, human trafficking is a serious yet often hidden issue in Stockton. Through a nurse-led trauma-informed intervention, we can identify victims, connect them to essential services, and ultimately contribute to breaking the cycle of exploitation. Nursing advocacy, interagency collaboration, and ethical, culturally sensitive care are vital for success. Here are the key sources used in developing this intervention. These references provide a strong foundation for implementing best practices. Thank you for your attention. I'm happy to answer any questions you have about this intervention or the role of nursing in addressing human trafficking.